A 37-year-old man with Crohn's disease is admitted to the hospital because of acute small bowel obstruction. Endoscopy shows a stricture in the terminal ileum. The ileum is surgically resected after endoscopic balloon dilatation fails to relieve the obstruction. 3 years later, he returned for a follow-up exam. He takes no medication. This patient is at most likely to have which of the following physical exam findings? Option A, weakness and ataxia. Option B, hyperreflexia with tetany. Option C, gingival swelling and bleeding. Option D, pallor with koilonychia. And option E, dry skin and keratomalacia. So here you did get, so weakness and ataxia. So it was, Crohn's disease, small bowel obstruction. So ileum has been removed. No, so if ileum has been removed, so you're gonna see that vitamin B12 deficiency can present with symmetric neurological deficit, including limb weakness, ataxia. Vitamin B12 is a cofactor for methylmalonyl coenzyme A mutase and methionine synthase, both of which are necessary for proper neural function. No, and the terminal ileum is the primary site of B12 absorption, and therefore resection of this structure, as seen in this case, it results in symptom of vitamin B12 deficiency unless properly supplemented. So I think you know it, but the question is saying this patient is most likely to develop which of the following exam finding later in the future. Okay, so it's gonna take time. He's not gonna develop, in 2 days or in 3 months or 4 months. Okay, so now why not option B? So option B is saying that hyperreflexia with tetany would be consistent with hypocalcemia. Although passive calcium uptake occurs throughout the entire small intestine, the majority of the calcium absorption occurs through active transcellular transport in the duodenum and proximal jejunum. Okay, the resection of this patient's terminal ileum is unlikely to result in significant calcium deficiency. Simply, calcium is going to be absorbed in duodenum mainly and in the proximal part of jejunum. If you remove ileum, he will not have calcium deficiency. Okay, but he could have. I said early in the class, they will have calcium deficiency because of that process. He will lose fat will combine with calcium and they're gonna excrete. So he could have, but it will not be severe enough to cause tetany. If your calcium, suppose normal calcium is suppose 9 or 10, so it will go up to 8. It will not go up to 6 or 4 or 5 to cause tetany if you remove ileum. Okay, so you keep it in mind. There's nothing like absolute. Okay, if you remove calcium ileum, then he's gonna have calcium deficiency. The doctor said early in the class. Now it is contradicting. No, it's not. He's gonna have deficiency, but just a little bit, not severe enough to cause like tetany. Okay, so now why not pallor with koilonychia? So pallor with koilonychia, you're gonna see in iron deficiency. So, and you said, I think doctor were responding that iron is something absorbed in duodenum. So gingival, what is that option? Yes, D. So D is saying pallor with koilonychia is consistent with iron deficiency anemia. Iron is first reduced due to ferrous. Iron is first reduced to ferrous form, that is Fe2+ before being absorbed in the duodenum and upper jejunum. This patient is at risk of malabsorption syndrome, but iron absorption is not dependent on the terminal ileum, making this finding unlikely in this patient. Okay, and why not C? Gingival swelling and bleeding would be consistent with vitamin C deficiency. Vitamin C is a water-soluble vitamin that functions as a important cofactor in collagen synthesis. Okay, this patient is at increased risk of malabsorption syndrome, but vitamin C absorption is not dependent on the ileum. Okay, so what is the process for which you need to know it? Okay, actually that's why I'm asking for what process in collagen. Simply saying collagen synthesis is not sufficient. Okay, so you have to know the exact, there is something hydroxylation. No, so you need vitamin C. I'm not sure whether you have been through collagen synthesis or not. So what happened? You need vitamin C for hydroxylation of some amino acid. Okay, so that is lysine. There's 3 amino acids in the collagen. Okay, glycine, lysine, and serine. I guess I don't remember exactly the third one, but you need to hydroxylate. Okay, so if somebody knows, just please type in the chat box. Okay, yes, valine. No, it's not arginine. I think it is glycine. If they ask you, there's one question they're gonna ask you, which one is the highest amino acid inside the collagen? You have to say it's glycine. Okay, that's one question. The another is it vary. One time it is yes, proline, I guess. Yeah, proline and lysine, I think. Okay, so hydroxylation of, I'm not sure if I'm wrong, please correct me. So I'm sure that there is one glycine which is 1/3. Okay, so it's fixed. So there is one question they're going to ask you, what is the, which amino acid is highest in collagen? So you have to say glycine, and then the rest, that is lysine and proline, I guess. So you need vitamin C to add hydroxyl group on the lysine and proline. Okay, if you don't have vitamin C, you cannot add hydroxyl group, and there is defective collagen synthesis. Okay, yes, proline and lysine, I hope so. So what happened? There is defective collagen synthesis. What going to happen if there is defective collagen synthesis? You know, in vitamin C deficiency, there is bleeding. You know, the question is saying there is bleeding. So why there is bleeding in vitamin C deficiency? So what happened? You cannot synthesize collagen. So what happened? You know, you might have been through the clotting pathway. So what happened? Whenever there is endothelial injury to the blood vessel, there is the collagen is exposed, and whenever blood is flowing and platelet, whenever collide with the collagen, they activate the platelet, and platelet is activated, and they help in formation of clot. No, platelet binds with the collagen, and more platelet comes, and they make a clot. This is how bleeding is stopped. So what happens? Those patients who are vitamin C deficient, what happens? They don't have proper collagen. They have defective collagen. So what happens? Whenever there is injury to their body and their collagen is exposed, their platelet is not activated, you know, as it happens in a normal patient. Okay, so due to which there is defective clot formation, and these patients are at increased risk of developing bleeding. Okay, so you will see a patient coming to you with gingival bleeding, petechia in the skin, think of vitamin C deficiency. Okay, so it is one of the important concepts. So now okay, so option E. Why option it is not E? No, so dry skin and keratomalaysia are consistent with vitamin A deficiency. Vitamin A is a fat soluble vitamin, and therefore its deficiency is associated with fat malabsorption condition, celiac disease, cystic fibrosis. The majority of the fat soluble vitamin absorbed occur in the proximal half of the small intestine. This patient is at risk for malabsorption syndrome, but the resection of terminal ileum would unlikely result in significant vitamin A deficiency. So, you know, it's controversial actually, you know. So we think that, oh, we are losing the bile. So we are losing bile, it means that we should have, the patient going to have a steatorrhea. If the patient is having a steatorrhea, then he should have deficiency of A, D, E, K, all. Okay, so what happens? You get D from the sunlight. Okay, so generally patient does not have deficiency of vitamin D because they are getting D from sunlight. Okay, so what happens? Those patients are generally at the risk of developing vitamin K, especially if you remove the ileum, especially, you know, K, not, and sometimes E. Okay, and as far as A is concerned, so if you remove the whole ileum, you know, you're gonna have A deficiency as well, but generally it is less. If you have to choose what deficiency you're gonna have, if you remove the whole ileum, you always go with the, you know, vitamin K. Okay, vitamin K or E rather than A and D. Okay, so A, D is something you get from, you know, like sunlight, and A, it is absorbed only in the ileum, not in the terminal ileum. Okay, if you remove whole ileum, then there's a chance you can have A deficiency. So these things are very, you know, related. Sometimes if I say fat soluble vitamin deficiency, and here the patient is having deficiency of, you know, vitamin B, only K, then you may say, oh, look, doctor, you said all fat soluble vitamin deficiency, you should have all, but it's not, because you have to understand that there are other sources of vitamin in our body, like we get from sun, we get from some part of vitamins are absorbed only in the intestine, some are solely absorbed in the ileum. Okay, so it depends.
Thanks for watching. Please give a thumbs up and subscribe for more.